Welcome to Podiatric Radiology Rounds. In this lecture, we're going to evaluate radiographic evaluation of degenerative arthritis. My name is Marlena Jbara, and I am a bone and joint radiologist at Staten Island University Hospital at Northwell Health. Just a review regarding rheumatoid arthritis and the presence of marginal erosions. This is indicative of an underlying synovitis, where the synovium is inflamed, creating an ingress of inflammatory cells into an area between the hyaline cartilage and joint capsule, known as the bare area. And we can see on this upper right example of this X-ray, these marginal erosions that can be seen in inflammatory arthritis. Here you can see these dense mineralized gouty soft tissue deposits adjacent to the joint structure with well corticated, punched out, obvious erosions, trying to deal with the tophaceous gout as it tunnels towards the bone. Notice the relative preservation of the joint space, even the presence of intraosseous erosions, as gouty erosions can be intra-articular, marginal or bare area, and eccentric, as this example on the top right. Of course, gout, you have preserved mineralization. There's no periarticular osteopenia unless there may be a secondary incited synovitis created, or the patient may have two different diseases such as inflammatory arthritis and gout. Charcot versus osteomyelitis, we can predict based on the weight-bearing mechanism of the current foot, with the pressure points being affected first at the first, fifth, and heel, being Cotton's triangle. Neuropathic changes will occur with greater than 85% distribution, not only at the forefoot from the toe clawing or the prominence of the metatarsal heads, but also at Lisfranc joint at the midfoot and at Chopard articulation between the hind to midfoot region.